Okay, let's unpack this deep dive. Today we're tackling something that, well, it can be a real challenge for pet owners and their vets: calcium oxalate urolithiasis.
Exactly. Think urinary stones in dogs and cats, but these aren't just any stones. We're diving deep into the stack of articles, research, and notes you, our listener, provided, trying to figure out what makes them so unique and often, so frustrating.
Right. Our mission, as always, is to pull out the absolute most important stuff, those surprising facts, the critical insights, so you walk away really well informed about this condition. It's pretty common. And let's get straight to maybe the biggest, most critical piece of information right up front, based on everything we've seen here.
And that is, these stones, calcium oxalate uroliths, they cannot be dissolved with medication or diet, period.
Okay, hold on. That's huge. So unlike some other stone types people might have heard about, you can't just feed your pet a special food and hope they melt away.
Nope. No dissolving.
Wow, that changes everything about how you approach treating this problem, doesn't it?
It absolutely does. It means treatment always involves physical removal, one way or another. But before we get to that, let's understand what they are and why they even form in the first place.
Okay.
So these are basically solid mineral masses, primarily made of calcium and oxalate, chemically bound together.
And they can show up anywhere in the urinary system, like the whole path.
That's right, anywhere urine goes. In the kidneys themselves, we call those nephroliths, down the tubes connecting the kidneys to the bladder ureteroliths. In the bladder, which is common cystoliths, or even in the tube where urine leaves the body, the urethroliths.
Got it. So they're little calcium oxalate rocks, basically, that can form anywhere along the pee path, and they don't dissolve. But why? What's happening inside the pet's body that causes these things to form?
It's usually a mix of factors, a bit of a perfect storm, but the core concept is that the urine becomes overloaded or supersaturated with calcium and oxalate.
Supersaturated, like too much sugar in iced tea.
Exactly like that. Imagine trying to dissolve too much salt or sugar in a glass of water. Eventually, it just can't hold anymore, and the solid stuff starts settling out as crystals. Same idea here. When the urine is too concentrated with calcium and oxalate, those crystals start forming, and then they can stick together, aggregate, and grow into stones.
But it's not just about having the minerals there, right? Other things push that saturation point, or maybe fail to stop it.
Precisely. Several factors contribute, and the research you shared really lays them out clearly. One big one is urinary pH.
Acidity.
Yeah, the acidity of the urine. While these stones can technically form in a range, they really prefer urine that's more acidic, down towards neutral. The goal for prevention, actually, based on these sources, is to keep the pH a bit higher, between 6.5 and 7.5. So slightly less acidic, maybe even slightly alkaline. Very acidic urine actively promotes their formation.
Okay, so acidity is bad news for preventing these.
Yeah.
What else makes the urine ripe for stone formation?
Concentration. Simple as that. If the pet isn't drinking enough or maybe losing water some other way, their urine gets more concentrated.
Makes sense.
And higher concentration means the building blocks, the calcium and oxalate, are packed into a smaller volume of liquid. That makes supersaturation much more likely. The sources highlight a key target: keeping urine-specific gravity, that's a measure of concentration, below 1.020 in dogs and below 1.030 to cats.
Okay, specific targets, and you mentioned diet.
Yes, and guess what's often linked to more concentrated urine? Dry food. Kibble. High-moisture canned food, on the other hand, naturally leads to more dilute urine because it contains so much water.
That makes intuitive sense. More water in, more dilute urine out.
Mm-hmm.
So what about the building blocks themselves, the calcium and oxalate? Is it always just too much in the diet?
Not necessarily just the diet. Hypercalciuria, which just means high calcium in the urine, is a major player mentioned in the research. This can happen for a few different reasons. Sometimes it's because there's genuinely too much calcium floating around in the blood that's hypercalcemia. The kidneys then try to filter out the excess. The studies found this in a significant percentage of cats, maybe 35%, but actually less commonly in dogs, only about 4% with these stones.
So high blood calcium isn't the usual culprit in dogs.
Often, no. More commonly, it seems to be something called idiopathic hypercalciuria.
Idiopathic meaning we don't really know why.
Pretty much. It means high calcium in the urine, but blood calcium levels are totally normal. For some reason, the kidneys are just letting too much calcium slip through into the urine.
Yeah.
And yes, diet can contribute too much calcium or too much protein or even too much vitamin D in the food. And certain medications can do it too, like loop diuretics, furosemide is a common one, or steroids, glucocorticoids. They can increase calcium excretion.
Wow.
And here's a fascinating detail from the sources: those diets that make urine acidic, They can also increase urinary calcium. It seems they affect how the kidneys filter and reabsorb calcium, kind of a double whammy.
Wow, okay, so acidity is bad, high concentration is bad, and too much calcium leaking into the urine is bad. What about the other half, the oxalate?
Hyperoxaluria, high oxalate in the urine, is another factor, though based on these sources, it seems less common or maybe less understood than the calcium side.
Where does extra oxalate come from?
It can come from eating certain foods high in oxalate. Things like chocolate, peanuts, spinach, sweet potatoes, rhubarb are mentioned, though, dogs shouldn't be eating chocolate anyway.
Right.
Excessive vitamin C intake can also be an issue. The body actually metabolizes vitamin C into oxalate, so too much supplemental C isn't good. There are also rare genetic defects. And interestingly, vitamin B6 deficiency can lead the body to make more oxalate internally. This is noted as a particular risk with some unsupplemented homemade diets.
Homemade diets, okay. That's good to know. There was something about gut bacteria too, wasn't there? That sounded interesting.
Yes, this is a really cool point the sources bring up. There are certain types of intestinal bacteria, Oxalobacter formigenes is the main one mentioned, that actually break down oxalate right there in the gut.
So they eat it.
Essentially, yes.
Good.
They degrade it, which reduces how much gets absorbed into the bloodstream and eventually ends up in the urine. So the thinking is maybe avoiding indiscriminate antibiotic use when possible could help preserve these beneficial bacteria and potentially lower stone risk.
That's a fascinating link between gut health and urinary stones.
Huh.
So we've got the minerals, the concentration, the acidity.
Mm-hmm.
Are there also things missing that would normally help prevent stones, like natural defenses?
Absolutely. Urine isn't just water and waste. It contains natural inhibitors that are supposed to help prevent crystals from forming or sticking together and growing. If there's a lack of inhibitors, stone formation is definitely more likely.
What kind of inhibitors?
The sources list several, things like citrate, pyrophosphate, and various proteins, like tamhorsfol, mucoprotein, nephrocalcin, osteopontin. There was even a preliminary finding mentioned about nephrocalcin in dogs that form stones. Apparently, it had fewer specific chemical binding sites compared to normal dogs, suggesting it might not be working as well.
And citrate is a big one here, correct? You mentioned that earlier.
Yes, hypocitraturia, low citrate in the urine, seems particularly important. Citrate is clever. It works by binding directly to calcium in the urine.
Oh, okay.
When citrate binds calcium, it forms a compound that is soluble, it stays dissolved, so it effectively takes calcium out of the equation so it can't hook up with oxalate to form those insoluble crystals.
So less citrate means more free calcium available to make stones.
Exactly. And the sources explain that conditions causing metabolic acidosis, like systemic acidity in dogs, are linked to lower urinary citrate. And guess what else lowers citrate? Those urine acidifying diets we keep mentioning. They make the kidneys hold on to citrate more tightly, so less gets into the urine to do its job.
Man, it really does sound like a complex cascade where many factors, diet, pH, concentration, inhibitors, even genetics, all interact.
They are definitely all interconnected. And speaking of genetics, the clear genetic predispositions we see in certain breeds strongly suggest there are underlying inherited tendencies that make some animals just more likely to develop this problem.
That brings us nicely to the who. How common is this, really? And which furry friends are sitting higher up the risk ladder?
Looking at the numbers from the sources, calcium oxalate is very, very common. It's often the most common, or sometimes the second most common, stone type found overall. It accounts for something like 42% of stones found in the lower urinary tract, the bladder and urethra in both dogs and cats.
Okay, so nearly half of lower tract stones.
Right. But listen to the split for upper urinary tract stones, the ones in the kidneys or ureters. In dogs, it's about 45% calcium oxalate. But in cats, a staggering 90% of upper tract stones are calcium oxalate.
Wow, 90% in cats for those kidney and ureter stones. That's incredibly high. That makes them much harder to deal with, I imagine.
Much harder. Location matters a lot. So who typically gets them? The general profile looks like this.
Okay.
Species. Both dogs and cats, clearly.
Typically middle-aged to older pets. Dogs average around 8.5 years old, with like 60% of cases happening between 6 and 11 years. Cats are usually over 2 years old, but the majority, over half, are between 7 and 15 years. So not usually puppies or kittens.
Right, and sex.
Sex, mostly males in both species. About 73% of affected dogs are male, and about 55% of affected cats are male. The anatomy, especially the longer Narrower urethra in males likely plays a role in obstruction risk, too.
Makes sense. And those breed risk factors, they seem pretty significant, especially in dogs, based on the
They
lists.
really are. The sources list the top 6 breeds that apparently make up 60% of all dog cases. Miniature Schnauzer, Lhasa Apso, Yorkshire Terrier, Bichon Frise, Shih Tzu, and Miniature Poodle.
So a lot of smaller breeds there.
A lot of small breeds, yeah. They also note others like Pomeranian, Dachshund, Cairn Terrier, Jack Russell, American Staffy, Border Collie, Boston Terrier, Bull Mastiff, Havanese, Rottweiler, and Staffy Bull Terrier. But miniature Schnauzers are particularly highlighted.
Why them specifically?
Well, the sources suggest a few potential reasons. They might naturally produce smaller volumes of more concentrated urine. Their urine might be richer in calcium, and maybe they just don't urinate as frequently as some other breeds, giving crystals more time to form.
And I remember the sources mentioned specific genetic forms of the disease.
Yes, this is important, especially for breeds like English Bulldogs, but others too. There's something called hereditary Oxalate Urolithiasis, types 1 and 2. These are known inherited autosomal recessive conditions. They can cause stones to form even in young adult dogs of these breeds, which is unusual for Ox otherwise.
Good to know there are tests for that. What about the at-risk cat breeds?
For cats, the breeds highlighted as having a greater risk include Himalayan, Scottish Fold, Persian, Ragdoll, and Burmese. So several long-haired or brachycephalic, flat-faced breeds seem overrepresented.
Okay, so if you have, say, a middle-aged male mini Schnauzer or maybe a Himalayan cat, you might be listening extra closely right now. Pulling together all those risk factors mentioned in the sources, it really sounds like feeding acidifying diets, especially dry kibble, is a big one. Also using certain supplements incorrectly, like calcium given apart from meals, or too much vitamin D or vitamin C, certain medications, and of course, just the genetic background of the pet, all playing a role.
Yeah, that pretty much covers the big risk factors that were identified in the literature you shared. It's definitely multifactorial.
Okay, knowing the risks is one thing, but what signs might you as a pet owner actually see if your dog or cat has these stones? How would you know?
Yeah, this is where it gets a bit tricky because the signs are really variable. It completely depends on where the stones are located, how big they are, how many there are, and critically, whether they're causing an obstruction, a blockage.
And sometimes, maybe no signs at all.
Exactly. The sources point out that stones just sitting quietly in the kidneys, or maybe small, smooth stones in the bladder that aren't causing irritation, they can be completely asymptomatic, silent.
So you wouldn't know.
You wouldn't know. They might only be found accidentally, if the pet gets an X-ray or an ultrasound for some totally unrelated reason, incidental findings.
But when there are signs, what are the red flags? What should people watch for?
Okay, so for stones lower down in the urinary tract, think bladder or urethra, the signs are usually the classic signs of irritation or difficulty peeing. The sources list things like peeing much more often than usual, maybe small amounts each time. That's pollakiuria, painful urination, where they might yelp or seem uncomfortable, dysuria, obvious blood in the urine, hematuria, and straining to pee, really pushing stranguria. For cats, a really common sign is suddenly starting to pee outside the litter box. That's often a sign of urinary discomfort.
Right, inappropriate urination in cats is a big one. And there's one situation that's like a flashing red light emergency situation, right?
Absolutely, and this is critical. Every pet owner needs to understand this. Urethral obstruction is a life-threatening emergency.
Okay, explain that.
If a stone gets washed down and lodges in the urethra, that tube leading out, especially in male pets with their narrower tubes, it can completely block the flow of urine. They physically cannot empty their bladder.
And the signs are?
The sources describe it clearly. Persistent, often frantic straining, but no urine comes out, or maybe just a few desperate drops.
Yeah.
The pet is often painful in their belly, might seem distressed, lethargic, could start vomiting, and can eventually collapse from the buildup of toxins and electrolyte imbalances. If you see your pet straining repeatedly with no urine output, that is an immediate rush to the vet emergency. Don't wait.
That's an incredibly important distinction. Straining with urine is one thing, straining with no urine is a crisis. Okay, what about stones higher up? In the kidneys or the ureters, what did they look like?
Upper tract stones, as we said, are often silent, sneaky. If they do cause issues, it's often because they're causing a partial or complete blockage of a ureter, that tube from the kidney. The signs can be much more vague then. Things like just not eating well, anorexia, being lethargic, maybe vomiting. They might show signs of abdominal or flank pain, sometimes called ureteral colic, sort of like human kidney stone pain. If the blockage is severe and backs up urine into the kidney, the vet might even be able to feel an enlarged kidney, what's called hydronephrosis.
And long term.
Yeah, long term, if the obstruction damages the kidney significantly, you could start seeing signs of chronic kidney disease develop.
So the signs can range from completely invisible to vague unwellness to a dire emergency. How do vets put all these pieces together and figure out if these specific stones, calcium oxalate stones, are the problem?
Well, the diagnostic process outlined in the sources is pretty systematic. It
Right.
naturally starts with the history you provide about the signs you've seen and a thorough physical exam by the vet.
Okay.
Then comes the lab work, usually urinalysis and urine culture. The urinalysis looks for clues like blood cells, white blood cells indicating inflammation, maybe protein, and they'll look for crystals under the microscope. Calcium oxalate crystals have characteristic shapes. Sometimes they look like little square envelopes. That's the dihydrate form. Or maybe like tiny dumbbells or picket fences. That's the monohydrate form.
But seeing crystals doesn't automatically mean stones are resin, right?
Correct. The sources strongly emphasize this point. Seeing crystals is a clue. It tells you the urine could support stone formation, but it does not confirm stones are actually present. And finding crystals alone doesn't automatically require treatment. The urinalysis also checks the pH, usually acidic or neutral, with Kox. And a urine culture is vital because stones, especially these Kox ones, can often get a secondary bacterial infection growing on them. You need to know if that's happening.
Makes sense. What about blood work?
Blood work, usually a CBC and biochemistry panel, checks the pet's overall health, looks for inflammation, and importantly, assesses kidney function and electrolytes. And a crucial step here is screening for hypercalcemia. They need to check both total calcium and, importantly, ionized calcium, which is the biologically active form in the blood.
Why ionized calcium?
Because total calcium can sometimes be misleading due to protein levels. Ionized calcium gives a truer picture of active calcium status. And if the calcium is high, the sources say they might run additional tests, like for parathyroid hormone, PTH, or PTH-related protein, PTHRP, to help figure out why it's high. Is it a parathyroid gland problem? Is it related to certain types of cancer? Finding the underlying cause is key.
Okay, so blood and urine give important clues and rule out other things. How do they actually see the stones, confirm they're there?
Imaging is absolutely key.
Yeah.
Indispensable, really. Survey radiographs, x-rays are often the first step. The good news is most calcium oxalate stones are radiopaque.
Meaning they show up on the x-ray?
Exactly. They show up white or dense on the x-ray film. So x-rays are usually pretty good for confirming stones are present, seeing where they are, roughly how many, and getting an idea of their size. But the sources remind us other stone types like struvite or calcium phosphate can also be radiopaque. So an x-ray confirms something dense is there, but doesn't definitively tell you it's calcium oxalate.
Yeah.
Also, sometimes other mineralizations in the urinary tract can look like stones.
Okay, so x-rays are useful, but not the final word on type. What else?
Abdominal ultrasound is incredibly valuable. It uses sound waves, so it can see things x-rays might miss. It can detect both radiopaque and radiolucent stones, stones that don't show up well on x-ray. It's also excellent for getting a detailed look at the kidneys, checking for signs of obstruction like a dilated ureter or kidney hydronephrosis, and examining the bladder wall itself for thickening or inflammation.
So ultrasound adds more detail.
A lot more detail, especially for the kidneys and soft tissues. The sources also mention contrast radiography, where they inject dye, like into the bladder, a cystogram, which can help highlight stones that might be hard to see otherwise, or show abnormalities in the bladder or urethra shape. And for the ultimate view, CT scans. CT is described as the most sensitive imaging technique. It's fantastic for detecting even very small stones, especially tricky ones in the ureters, and really assessing the extent of any blockage.
Okay, so imaging confirms there's a stone-like object, maybe strongly suggests it's Kox based on appearance and location. But to know for sure, absolutely sure that it's calcium oxalate, you need something more definitive.
You absolutely do. And this is probably one of the most critical messages from all the source material. Urolith analysis is mandatory for definitive diagnosis and proper management. The sources couldn't be clearer on this. Yes. The stone itself must be physically retrieved, whether the pet passes it naturally, it's flushed out, removed surgically, or captured during a scope procedure, and it must be sent to a specialized laboratory for quantitative analysis. That means they figure out exactly what minerals it's made of and in what proportions. This is the only way to know for sure if it's 100% calcium oxalate or maybe a mix, which is crucial for planning long-term prevention. You can't base prevention on assumptions.
Save that stone. Get it analyzed. Got it. And what about that genetic testing you mentioned earlier?
Yes, for those predisposed breeds, like English Bulldogs, but also others where these hereditary forms are known, the sources mentioned that genetic testing is available. Finding out if a dog has one of those specific genetic mutations can really help inform the management plan and maybe expectations for recurrence.
Okay, so we found the stone. We know it's calcium oxalate thanks to analysis. Now what? Given that critical point, they don't dissolve, what's the actual treatment plan look like?
Right. As we said right at the start, and it bears repeating, calcium oxalate stones cannot be dissolved with special foods or medications. So treatment always involves two main parts. First, physically removing the stones that are currently there, and second, committing to a lifelong strategy to prevent new ones from forming.
Okay, let's break that down. Let's go back to that emergency situation, firstly, obstruction. What happens then?
Okay, for urethral obstruction, the blockage on the way out, it's all about urgent relief. The vet needs to get urine flowing again fast. They'll typically try techniques like retrograde urohydropropulsion, basically flushing the stone backwards from the urethra into the bladder where it's less immediately dangerous. Or they might try to pass a urinary catheter past the stone. If those fail, surgery, urethrostomy, or urethrostomy might be needed to remove the stone, though the sources suggest trying to avoid permanent surgical alterations to the urethra if possible, as they can have complications.
Right, and a urethral obstruction, stones stuck between kidney and bladder.
That's also an emergency, because it can quickly damage the kidney upstream. Treatment involves stabilizing the pet first, usually with aggressive IV fluids, pain management, and then intervention is usually needed pretty quickly. Options include surgery to actually open the ureter and remove the stone, ureterotomy, or sometimes more complex surgeries like bypassing the blocked section or reimplanting the ureter into the bladder, urethrostomy. But especially in cats now, the sources highlight the increasing use of specialized devices like S-subs, subcutaneous ureteral bypass systems, or ureteral stents.
S-subs. Tell me more.
A sub is basically a surgically placed tube that runs under the skin, connecting the kidney directly to the bladder, creating a permanent bypass around the blocked ureter. Stents are tubes placed inside the ureter to hold it open. These are often done by specialists and can be life-saving for cats with ureteral stones.
Wow, that sounds like some clever plumbing work. Okay, so that's emergencies. What about stones that aren't causing a crisis right now? Say, stones found incidentally in the bladder, or maybe kidney stones that aren't blocking anything. How do you get those out?
For those non-obstructing stones, there are several options, and the best choice depends on the stone's size, location, number, and the pet's condition, plus available equipment. For very small bladder stones, maybe less than 3 or 4 millimeters, voiding urohydropropulsion can sometimes work.
That's the flushing technique.
Right. Under anesthesia, the vet fills the bladder completely with sterile saline, holds the pet upright, and then carefully but forcefully squeezes the bladder to try and flush the small stones out through the urethra. It's less invasive than surgery, but only works for tiny stones, and tends to be easier in female dogs with their shorter, wider urethra.
Okay, what if they're bigger?
Then the traditional and still very common method for bladder stones is cystotomy. That's straightforward surgery. Making an incision into the bladder, physically removing all the stones, flushing thoroughly, and sewing the bladder closed again. The sources make a point here about minimizing the amount of suture material exposed inside the bladder, because suture can actually act as a nidus, a starting point for new stones to form later.
Good tip. Are there less invasive options for bigger stones too?
Yes, increasingly there are minimally invasive techniques, though these usually require specialized equipment and expertise, often found at referral centers. One is laser lithotripsy. They use a tiny camera scope, cystoscope, passed up the urethra into the bladder, visualize the stone, and then use a laser fiber passed through the scope to break the stone into smaller fragments that can then be flushed out or removed with tiny baskets.
Breaking them up from the inside.
Exactly. Related to that is basket retrieval, where they use a scope and a tiny basket to just grab and remove small stones whole. And for stones higher up, particularly in the kidneys, extracorporeal shockwave lithotripsy, ESWL, is an option mentioned. This uses focused high-energy sound waves generated outside the body to break up the kidney stones into smaller pieces that can then hopefully pass down naturally. But ESWL requires very specialized, expensive equipment and isn't widely available in veterinary medicine.
Okay, so lots of ways to get them out, from flushing to traditional surgery to high-tech lasers and sound waves. But getting them out is really only half the battle, isn't it? Because these stones have this nasty reputation for coming back. How do we tackle prevention?
This is the critical and often challenging lifelong part, medical management for prevention. The whole goal here is to change the urine environment, to make it hostile to calcium oxalate crystal formation and growth.
Hmm.
You want to make the urine less supersaturated and less inviting for these stones.
And where do you start?
You start with the absolute cornerstone of prevention, which is diet. This was emphasized heavily in all the sources. Feeding specific prescription therapeutic diets designed for calcium oxalate prevention is usually crucial. The sources mention several examples like Hill's Prescription Diet Ode or CD Multicare and Royal Canin Urinary SO. These diets are very carefully formulated to do several key things simultaneously.
Like what?
Well, first and foremost, increase moisture content. This was highlighted as absolutely crucial. Getting more water into the pet dilutes the urine, lowering that specific gravity concentration we talked about.
So canned food is better.
Canned therapeutic diets are generally preferred because they inherently contain much more water, like 70–80%. If feeding dry is necessary, adding a specific measured amount of water is essential to help reach those target urine dilution goals. SG 1.020 dogs, 1.030 cats. But the sources explicitly state that just casually adding a bit of water to dry food or mixing wet and dry without careful calculation often isn't enough to get the urine dilute enough on its own to make a real difference. Consistent high moisture intake is key.
Okay, moisture, moisture, moisture. What else do the diets do?
They also carefully control the levels of the stone building blocks, reducing protein, calcium, and oxalate precursors. They ensure adequate levels of natural inhibitors, like magnesium and phosphate. And importantly, they are formulated to promote urinary alkalinization. They help push the urine pH up towards that target range of 6.5 to 7.5, making the environment less acidic and therefore less friendly to Kox formation.
So the right food is the first and usually the most important line of defense. What about things owners should absolutely avoid feeding? Treats, supplements.
Yes, avoidance is also key. Avoid foods known to be high in oxalate. The sources mention spinach, sweet potatoes, rhubarb, peanuts, chocolate again. Avoid giving extra calcium supplements, especially if given separate from meals, which can increase absorption. Definitely steer clear of vitamin D supplements unless specifically prescribed for a deficiency, and avoid vitamin C, ascorbic acid supplements, because remember, the body converts excess C into oxalate. High-sodium foods or treats should also be avoided as sodium can increase calcium excretion in urine. And of course, avoid any diet or supplement that promotes acidic urine. Stick to the plan.
Makes sense. What if the special diet alone isn't quite enough to get the urine pH or maybe the citrate levels exactly where they need to be for optimal prevention?
That's a common scenario, and that's where medication often comes in. The most commonly used one mentioned is potassium citrate.
How does that help?
It has a really helpful dual benefit. First, it's an alkaline salt, so giving it orally helps buffer the acid in the urine, directly raising the pH towards that target 6.5, 7.5 goal. Second, it increases the amount of citrate in the urine. And remember, citrate binds calcium, keeping it soluble and unavailable for stone formation. So it alkalinizes and boosts a key inhibitor. The dosage, mentioned as roughly 7,550 milligrams per day divided, often needs adjusting based on follow-up urine pH tests to hit that sweet spot.
Any catches with potassium citrate?
One thing the sources mentioned was to avoid formulations that also contain cranberry extract. Cranberry is often added to urinary supplements for UTI prevention, but it's also a source of vitamin C, which we want to avoid giving in excess here. So pure potassium citrate is usually preferred.
Okay. Are there other medications for maybe tougher, more recurrent cases?
Yes, for pets that are really persistent stone formers, meaning they reform stones quickly, maybe within a year, even with diligent diet and potassium citrate therapy, another medication called hydrochlorothiazide is mentioned.
What's that?
It's a type of diuretic, a thiazide diuretic. Its relevant effect here is that it actually helps reduce the amount of calcium the kitties excrete into the urine. So it tackles the hypercalciuria problem directly. The dosages mentioned were around 2 mg/kg for dogs and 1 mg/kg for cats, usually given twice daily. However, because it's a diuretic and affects electrolytes, it requires careful monitoring by the vet, particularly checking blood potassium levels, as it can sometimes cause hypokalemia, low potassium.
So that's more for the frequent flyers, the really tough cases.
Exactly. It's usually reserved for those highly recurrent situations.
And what if that initial blood work showed the pet was hypercalcemic? High blood calcium was the root cause.
Then obviously, addressing the underlying cause of that high blood calcium is paramount for long-term prevention. If it's primary hyperparathyroidism, that might mean surgery to remove the affected parathyroid gland. If it's related to cancer, treating the cancer is key. For that tricky idiopathic hypercalcemia in cats, specific dietary management strategies are often tried first. The sources mention diets like Hill's WD or CDR. Multicare sometimes help normalize calcium in these cats. Cautious use of bisphosphonate medications might also be considered in some cases.
Got it. We talked briefly about vitamin B6 and those gut bacteria earlier. Do they come into play for prevention strategies?
They can. Vitamin B6 pyridoxine supplementation might be considered, particularly if the pet is on a homemade diet, as B6 deficiency can increase internal oxalate production. The dosage mentioned was relatively low, 2 to 4 milligrams every 1 to 2 days. And regarding the gut bacteria, Oxalobacter, while specific probiotic supplements aren't really mainstream or proven yet, the concept reinforces the idea of using antibiotics judiciously to potentially preserve the natural oxalate-degrading gut flora. It's an area of ongoing interest.
It really sounds like a very tailored, multifaceted prevention plan is needed for each individual pet based on their specific situation and stone history. Are there any potential downsides or complications with using these special prevention diets long term?
Yes, the sources do mention a few practical considerations. The biggest one is palatability. The pet has to consistently eat the prescribed diet for it to work. If they don't like it and don't eat enough, malnutrition or weight loss is obviously a risk. Also, some therapeutic diets, particularly ones like UD, that are also designed for dissolving other stone types like struvite, can be higher in fat.
And that's a problem for you.
For breeds that are already prone to issues with fat metabolism, like our friend the miniature Schnauzer, with their known predisposition for hyperlipidemia, high blood fat, and pancreatitis, feeding them a high-fat diet long-term could trigger those problems. So for those dogs, the sources suggest potential options like maybe mixing the UD with a lower-fat, non-acidifying diet like Hill's WD, or perhaps just using the ruoduratin along with potassium citrate to manage the KX risk without the high-fat load. It really highlights the need for ongoing discussion and partnership with your vet to find the best, safest long-term plan for your specific pet.
That makes perfect sense. It's not one size fits all. Okay, so we've removed the stones. We've started a prevention plan with diet and maybe meds. What's the long-term picture really look like? What's the prognosis, and what does keeping these stones away involve in practice day to day?
Well, the prognosis for successfully removing the current stones, whether by surgery or minimally invasive methods, is generally considered very good to excellent. The procedures themselves are usually successful. However, the prognosis for preventing recurrence is consistently described in the sources as guarded.
Guarded? That sounds not great. Concerning.
It is, and this is a really key takeaway point from all the research you provided. Recurrence rates for calcium oxalate stones are frustratingly high. The statistics mentioned are sobering. Roughly 50% of dogs and about 33% of cats will reform stones within 2 years, even when receiving what we consider appropriate contemporary prevention therapy.
Half the dogs, even with the special diet and monitoring. Wow.
Yes, and pets that have persistent underlying issues, like unresolved hypercalcemia, are even more likely to reform stones, and often faster. This is why lifelong prevention isn't just recommended, it's absolutely essential. And yet, even with the best efforts, recurrence remains a significant challenge with this particular stone type.
So this is absolutely not a fix it and forget it kind of problem. Monitoring must be incredibly crucial then.
It could be more crucial. It's non-negotiable if you want to minimize recurrence or at least catch new stones early. The sources detail a pretty rigorous recommended monitoring schedule.
What does that involve?
Okay, first, again, stone analysis is mandatory after any removal. You have to know what you're preventing. Second, they strongly recommend post-removal radiographs within about 24 hours, maybe a bit longer, just to confirm that all stones and fragments were successfully removed. You need a clean baseline.
Makes sense. Then what?
Then, regular urinalysis and urine culture and sensitivity are needed frequently. The suggestion is usually every 1 to 3 months initially after starting prevention, then stretching out to maybe every 3 to 6 months for the rest of the pet's life.
Lifelong urine checks.
Lifelong. These regular checks are vital to monitor that the urine pH is staying in the target range, 6.5 to 7.5, that the urine-specific gravity is staying low enough, dilute, to look for any reappearance of KX crystals as an early warning sign, and importantly, to screen for urinary tract infections, which can complicate things. And a key detail here, these samples should ideally be collected properly by the vet, usually via cystocentesis, a sterile needle into the bladder. The sources warn that owner-collected free catch samples, or samples that have been refrigerated for a while, can easily be contaminated or have altered pH or crystals, making the results unreliable for precise monitoring.
Okay, consistent, properly collected urine checks. What else?
Regular medical imaging. Because we know stones can reform even without obvious crystals in the urine, periodic imaging, usually with radiographs or ultrasound, is also essential. The recommendation is typically every 6 to 12 months, maybe more often for very high-risk pets. The goal here is to detect any new stones early, ideally when they are still small.
Why catch them small?
Because if you catch them when they're tiny, you might have more and less invasive options for removal, like that voiding urohydropropulsion technique we talked about, potentially avoiding another major surgery.
Ah, okay. Proactive surveillance. Anything else?
And finally, periodic blood work, CBC, biochemistry, and especially checking ionized calcium is usually recommended, maybe annually or biannually, just to monitor the pet's overall health, kidney function, and crucially to make sure hypercalcemia hasn't developed or recurred.
Wow. That's a significant commitment of time, effort, and expense for the pet owner, isn't it? Lifelong special food, maybe daily medication, frequent vet visits for urine tests, regular x-rays or ultrasounds?
It really is. And that's why the sources explicitly include a section emphasizing client education. Because the pet owner, you, are absolutely central to the success or failure of prevention. You need to understand up front that dissolution isn't possible for these stones, that prevention is truly lifelong, that recurrence rates are high even with good compliance, that the diet, especially the high moisture aspect, is critically important and non-negotiable, that encouraging water intake is vital, that the monitoring schedule is essential, not optional, that knowing the signs of obstruction is crucial because it's an emergency. You need to be prepared for the potential cost involved, understand potential genetic factors, and know when referral to a specialist might be beneficial for complex cases or advanced procedures. It's a true partnership.
Phew. Okay. We have really taken a deep dive here today. We've covered what calcium oxalate urolithiasis actually is, the complex web of factors that contribute to it forming, the sometimes subtle, sometimes dramatic signs you might see, how vets go about diagnosing it, why the treatment approach is fundamentally different because they don't dissolve, and the absolutely critical, intense, lifelong focus needed for prevention and monitoring.
Yeah, I think the core challenge really comes down to this. These stones require physical removal, full stop. And then preventing their return is this constant ongoing effort centered on getting enough moisture into the pet, primarily through diet, carefully controlling urine pH and composition, encouraging water intake however possible, and then just diligent, regular monitoring to catch problems early. The high recurrence rate really underscores just how difficult and frustrating this particular condition can be to manage long term.
Understanding all this information, all these details from the sources you provided really helps you, the listener, appreciate the nuance and the significant ongoing partnership required with your veterinarian if your pet is diagnosed with this condition. It hopefully empowers you to be a knowledgeable, active participant in developing and sticking to that long-term care plan.
And maybe if we step back and look at this condition from a slightly broader perspective, it prompts a thought. Think about this. Given these high rates of recurrence, even with diligent prevention, and the absolute necessity for constant monitoring via vet visits, imaging, lab tests, and the owner's strict adherence to diet and maybe medication protocols, how does managing a chronic, often silent disease like this in animals, who can't verbalize, who can't tell us if they snuck a forbidden treat or if they're feeling just slightly off until maybe the problem is quite advanced, how does this highlight the really unique partnership and profound responsibility we have as pet owners? It seems to require a level of constant vigilance, communication, and commitment that goes far beyond just providing basic food and shelter.
That really does raise an important question for you to consider as you process all this information. What does managing a complex, recurring condition like calcium oxalate stones truly teach us about the depth of commitment, observation, and communication required in our relationships with our animal companions?
It's certainly something worth pondering.
Well, thank you for bringing this incredibly important and frankly quite complex topic to the deep dive today. It's clear there's a lot involved in managing these stones.